Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Shiv Rao. He's a cardiologist and a physician executive. His Kevin MD article is titled, "I'm Tired of Being a Distracted Doctor." Shiv, welcome to the show.
Thank you so much, Kevin. And I was just sharing with you, you're like this mythological figure for me and probably any number of clinicians out there. So it's such a privilege to be here with you.
Oh, thank you so much for those kind words and sharing your time. So let's start by just briefly sharing your story and journey to where you are today.
Yeah, absolutely. So I'm a cardiologist. I'm also the CEO and founder of a company called A Bridge. A little bit about me before this. So prior to this, I was an investor at a large health system called UPMC. I sort of violated Peter's principle many times, like 10 times in 5 years, but I ended up being a leader, a check writer for their provider facing portfolio that was looking to invest in solutions that could help doctors or nurses in hospitals and clinics. Learned so much in that position. I got to sit on boards and just osmotically absorb as much wisdom as possible from disciplines I hadn't been really exposed to as a clinician. A lifetime ago, I went to Carnegie Mellon University as an undergrad
Mhm.
and studied any number of things I'm not really directly doing right now, but in the middle became a cardiologist. And really, I see myself, at the core as a clinician who's now trying to create as much impact as possible using tools like technology.
Tell me about that transition from that clinical side into what you're doing now. And I talk to so many doctors about that journey outside of clinical medicine, making a difference outside of clinical medicine and potentially impacting more patients. So tell us a little bit about that journey.
Yeah, absolutely. Not to get too deep into a life story that happened too long ago, but I think I did sort of get to med school in a circuitous way in the sense that I was subconsciously rebelling in college against all the Indian doctors in my family and in the world. And I really wanted to do something different. And, for a moment, all I did was skateboard. I was
Hmm.
making music. My roommate and I selling records in Japan. He had a record label, like doing a lot of things that were sort of off the grid. And then I remember the moment junior year of college getting really inspired by a lecture by an architect, William McDonough, where he told this story about this ophthalmologist in India who had designed this revolving platform on which he would sort of bring patients in around it at 12, 3, 6, and 9, and he would do cataracts. He would just do a cataract 15-minute spin, cataract spin, cataract spin. And by the time I'd seen this lecture, I'd heard this lecture, he had already given eyesight to over 1 million people. His daughter had given eyesight to over 400,000 people. And I just remember thinking, wow, like I just want to be a part of a team that can create that
Hmm.
kind of impact. Not that it's any less valuable to sort of create deep impact for one person in your life, but there's something about scale that really resonated with me as a person. And so pivoted, took a couple years, did pre-med requirements, went to med school, soul got crushed, didn't see a lot of room for creativity, went to residency at University of Michigan and things opened up, just fell in love with patient care and really like got my footing and saw myself as like as the internist, or the cardiologist that you would really get to know as like a generalist who could really know all sort of aspects of your care and be deep, but then was also starting to get this bug around technology. I sort of saw technology as a way to do what I didn't have the patience to do in basic science research. 13 years bench to bedside in the lab, animal experiments. That's not me. I have a little bit of AD&D. I need tighter feedback loops. And so technology sort of checked off all the boxes and I built something for the residency program, experienced some peasant level of product market fit. And, along the way to where I am today, I had this like a failed startup or like a startup experiment. And, here I am. But I'd say at the end of the day, it's about impact for me and like, selfishly, like the kind of fulfillment you get as a clinician when you feel like you really made a difference, whether it's in a clinic, whether it's in ICU. I think it's the same sort of high that you can get when you go off the grid a little bit and sort of like maybe better to say when you cross the T and you're leveraging your depth as a clinician to do something different. And that different thing could be any number of things, but I think technology is certainly a creative way to sort of flex your expertise.
So we're going to talk about one aspect of that technology that's really in the news a lot, generative AI. Your Kevin MD article is titled, "I'm Tired of Being a Distracted Doctor." Tell us how your article came together.
Yeah, I think we all know the statistics about clinician burnout, and this is the audience that doesn't need stats. And we all have stories, and I think stories are more powerful for us to share with each other. And that's what you allow for is storytelling. And like these are true stories, and that's I think where the ultimate, well, like the most impact is. For me, so many stories. Like one, my dad, retired cardiologist. Why did he retire? He couldn't type fast enough.
Hmm.
um at the same time, I mean, one of the most inspiring clinicians I know, his patient cohort just adored him, and to this day, like they see him as something different, like some from another era. That's sort of, yeah, as much as he was a cardiologist, he was sort of that almost like internist, that primary care clinician who would visit you at home, sit down with you, know your whole family story, know you not just as a patient but as a person. And idealistically, I think, I've always wanted to aspire to walk in his footsteps and build that kind of rapport with my own patients. And I think what we all realize when we go into practice is the incentives aren't aligned for that kind of practice, or at least naturally they're not aligned. And sometimes you need to do some really creative things to find a way to make the economics work in such a way that you can achieve that kind of rapport or get compensated for it. But certainly, while it's been a little over a year or two since 2 years probably since I've had a regular weekly clinic, I still see patients. I'll do a call one weekend a month, and I'll take a call maybe a night a week. I'm on call tonight for cardiology. It's like feeling that pressure of needing to move from one
Yeah.
patient to another to another to another. There's always this cognitive overhead.
Hmm.
And sometimes I would get over that cognitive overhead by the night before doing a chart biopsy. Because, okay, I'm going to be present for my patients tomorrow. I'm going to be in the moment. I'm going to look them in the eye. And so I'm going to write their notes the day before and basically template everything and sort of predict all the diagnoses I'm going to make and what their story might look like. And that way feel sort of unburdened
Yeah.
to be in the moment with them, and then like fill in the gaps and write my notes. Like that's the opportunity. That's really the wedge, but that's the opportunity that generative AI has. I think what it can do for us, what it's going to do for us over the next 2 years is just going to be absolutely paradigm shifting. And that's what I think clinicians have the opportunity, right now to be leaders in directing. And they should take advantage of this opportunity right now to be leaders in this new sort of paradigm.
All right. Now, just to get everyone on the same page, give us a 30-second synopsis of what generative AI is.
Yeah, it's a really good question. So I think many of us are familiar with AI systems that produce simple outputs, like say a number, for example, the predicted length of stay for a patient in the hospital, or a category, like say, is this nodule on a CT scan malignant or is it benign? Generative AI, though, it refers broadly to systems whose outputs take the form of more unstructured, complex media objects. So think about an audio file, think about an image, think about a document, a whole document. What's sort of interesting and fascinating, and what our computer scientists have taught me over the years, is that under the hood, many of those systems are actually built by executing models that serve a more classical purpose. So, for example, ChatGPT, when you're playing with it, you're creating this whole document, but what's happening underneath the covers is that it's iteratively sort of predicting what word comes next.
Hmm.
But when you think about it, the ability to produce a whole document with desired properties, or a whole image with desired properties, or audio or video, it just unlocks a whole host of exciting applications. And when you think about healthcare, you can't sort of swing a stick without hitting potentially an incredibly impactful opportunity for generative AI, because healthcare at the end of the day is about words that are
Yeah.
spoken and then words that are documented. And when you have that much data, 80%, over 80% of the data in healthcare is words. That's the opportunity. That's why this is going to be so paradigm shifting. And that's why more than any other industry out there, this is where we're going to see the most impact.
So tell us your vision of how generative AI, how does that fit into today's healthcare paradigm?
Yeah. I think that what it's going to do, what it's already doing, what we're seeing in practice, it's not presentation, is that it's actually making healthcare feel more human again. And us clinicians, we've heard this refrain before: technology is going to help you. Just do this extra thing, open this new website. It's going to help you in the end. And rarely does it, or has it in the past. You might argue. There are, and it's really, it's usually not the fault of the technology
Yeah.
itself. It's the fault of the incentives
Yeah.
that are sort of guiding or directing that technology to ask us to check off all these new boxes, or do prior authorization for all these medications or imaging studies that you need to order for your patient. So I think what's interesting and what's exciting about this technology is that it can take all that clerical work that we have to do off our plates.
Yeah.
At least set the table. It's almost like not AI. It's like it should stand for artificial intern. That person in the corner of the room who's sort of setting the table for you. And they might not be creating like the perfect set of orders, like the perfect note, or doing prior auth the way we need it to be done. But creating that draft allows us to be curators. And I think there's a creativity in curation that I think clinicians are, we lend very well to, like that, like lends itself very well to us. Because at the end of the day, what do we want to spend our time on? It's thinking, it's listening, it's looking people in the eye, it's building rapport, and then creatively figuring out what the diagnostics and therapeutics are. Because as we all know, as much data as they're in, and I'm certainly in one of the most data-driven disciplines of all, in cardiology, this is alchemy, like this is art. And we're connecting so many dots together to make decisions. So I don't see AI replacing clinicians in the sense that we're going to need creativity. We're certainly going to need human connection. I do see it augmenting us. And there's a refrain that's become popular that I absolutely agree with, because we need this. This is absolutely is going to be true, is that doctors who use AI are going to replace doctors who don't. And I think over the next 2 years, 80% of clinicians are going to be using generative AI in some way, shape, or form so that they can be more present with their patients.
So tell us a scenario where you use generative AI, say in an outpatient cardiology clinic. Just walk us through a hypothetical scenario so the listeners can really visualize the practical application.
Yeah, absolutely. So there are any number of applications, and I'll go through the one that certainly my team focuses on building against. 2 weekends ago, I was in clinic. I walked from room to room to room. I'd walk into a room with this technology on my phone, and I'd open up a bridge, and then I have a normal conversation with my patient. And at the end, I'd hit stop on this technology, and then I'd swivel my chair, and my note is there, and it's written in the way I like it. It reads like that clinical note, with all the style, with all the formatting. It's structured the assessment and plan in a problem-based way. It sort of also helped me understand what diagnoses did I speak
Mhm.
to. It's mapped those diagnoses to codes so I can create the most complete representation of the conversation that I have. It's captured the patient's history in a colorful and a dense and a rich way per my preference, which I can set. So it's capturing some social determinants of health information, some social history, information that I'm going to be able to leverage to hit the ground running with rapport when I see them again in 6 months. And I'm just trusting and verifying. I'm maybe making some edits, and then I'm finalizing. And then I'm also able to send a version of that note to my patient. And that's something that they could get in the portal or somewhere else. And that is going to represent the same conversation, but written at the level that will help them improve their own health literacy, hopefully, but also improve their ability to follow through and be the healthiest versions of themselves. So that's what we're building. That's what's live. That's what thousands of clinicians are using to save 3 hours a day sometimes in primary care. And that's just the tip of the spear here in terms of what generative AI could do. Because imagine multimodal generative AI that can parse through the electronic medical records and look at imaging and look at labs and look at all the notes and sort of summarize that whole history into a pithy paragraph. That's where this is going to go very quickly. But certainly, there's any number of use cases beyond that.
So just to be clear, you go into an exam room, you bring out your phone, you turn on this app, it records the interaction that you have with the patient, and then shortly after, it has a whole clinical note documenting that interaction. When you say that you have to do some editing afterwards, how long does that normally take you?
On average, it takes people 28 seconds sometimes. That's what we see with some of our clients that we're serving right now. So, very, very little time. And there's something more profound here too. It's there's ROI in the time saves, like it's hours. There's ROI in, in a complete new note. But the ROI that you get from unburdening clinicians, like from the psychological overhead of having to shift gears and, think about not just the clinical perspective, but the billing perspective and then the patient perspective, that's really hard to put a number on. I'd love for all of us to like sort of collaborate as a clinician community and put a number on burnout.
Yeah.
Like it's invaluable. Like you can't put a number on it. You see a patient, you leave, and like in my case, I'm always hyper cognizant that I'm writing a note for other clinicians to read and grok my mind, my thinking. And then I'm sorting through all these drop down menus to get to a specific diagnosis and ICD code that
Yeah.
crushes my soul. Last thing I want to do. I'm always doing the lowest hanging diagnosis, which is non-specific. So they chart chase me for the next weeks. And then I'm thinking, well, wait, my patient's going to read this note. They're going to go to the portal. And in my case, they're going to see a term like transcatheter aortic valvuloplasty. And understandably, reasonably, they're going to have questions. I'm going to have inbox messages and phone calls asking, what's that word? I Googled it. Sounds scary. So that's what we're doing, everything that I just described. And I really do believe this is one of any number of use cases that companies can build now, physicians can help build. But this use case that we're building is really ultimately about helping clinicians be less distracted, more present, and to feel less burned out and get more energy from the thing that drew them to this profession in the first place. And that's like the human service.
Now, do you have to train the tool that you're talking about? Because I know with ChatGPT, you have to play around with prompts to make sure that you get the right output. Even with dictation, you have to train, drag in some other systems to make sure that it's producing the output that you want. So, for these specific tools that you're talking about, geared towards writing notes, is there any training or any kind of build up time before it's functional?
No, you immediately go with it. In fact, any clinicians could ping me right now and you can just start to go with our solution. But that's what's elegant about certain, I think, applications for generative AI that you don't, it's not yesterday's technology. This is technology that will immediately create value. And will it get better over time? Absolutely, it will. It's gonna, get further tuned, and you're gonna be able to further train models. And I think that's part of like the magic of this moment right now in 2023. It just feels historic. It feels like these aren't tailwinds for what can happen to our profession right now. It feels like a tornado. And I think that clinicians, this is our moment to sort of direct the tornado in the direction we need it to go and make sure that it doesn't go somewhere else. Because certainly technology is a tool. You can use it for whatever means, whatever purpose. But I think in this case, like what we have an opportunity to do is make sure that it does the thing that we've always needed. It helps us kind of return to our roots as the original care advocates, as creative thinkers who are thinking through differentials and at the end of the day, like, delivering care that improves outcomes.
So one of the critiques I hear about generative AI when it comes to healthcare is sometimes the privacy concerns, right? Because it's pretty much going to be using a lot of that patient information for future iterations of its tech. So talk about some of the privacy issues that people sometimes critique these uses for.
Privacy is paramount. We all know that. And I think, to be quite honest with you, I believe that privacy, really this bigger umbrella of trust, that's actually going to be the big differentiator for generative AI centered applications in this industry, in healthcare. If you're, one of us as consumers and we start to use ChatGPT, or in the case of my 13-year-old, using ChatGPT to write your papers and do all your homework, as clearly she is, that's a different use case, right? Like I don't mind so much when she's feeding, public models a lot of data. And when we're using, and it's amazing service that we all have access to now. And I'm incredibly grateful for what companies like OpenAI are doing for all of us. And at the same time, when you apply that same technology to an industry like healthcare, where trust is table stakes, privacy is paramount, you have to put a lot of rigor into what you build beside, underneath, and on top of those models. You might even have to fine tune those models. And you certainly need to build infrastructure that allows this data to sort of do what needs to be done to deliver the value, but nothing more. And you need to create a covenant with your users, clinicians, and those patients that you're gonna you treat this data with the utmost care. So that's going to be the difference, and that's easier said than done. I think that it's easy anymore to use, and it will probably be flooded with tech like solutions over these coming months, years, that are generative AI focused, but that don't have that sort of hygiene that healthcare should demand. But I do think that the dust will settle over the next year, and it'll be clear who is creating solutions that really carefully manage data, who is creating solutions that are building auditability into their models, transparency into how things are working and looking, so that we're comfortable using them with our patients.
So, as you know, there are several companies with these generative AI solutions similar to what your company is doing. So, from a physician standpoint, what kind of things should we be looking for specifically as it relates to patient privacy and security that would separate these companies when making a choice?
Yeah, absolutely. Well, I think that there's a high level phenotype for a company that to me makes sense and is magical in healthcare. And the high level phenotype sort of translates into the more granular things that they might do, that they might implement inside their company, the processes, that sorts of, professionals that are going to be in place. At the highest level, on the phenotype level, I think these companies should be healthcare native as much as they are AI native. And if you have one without the other, it's interesting. Like if you're AI native, but you don't have like the clinicians on the team, then I think the risk is that maybe this is an opportunistic solution that's going to create or try to make a quick buck, but not really have a long-term vision or roadmap to create the kind of value that can truly transform the profession. Similarly, I think if you're healthcare native without the computer scientists, without the technologists, the engineers, the designers, who should have a level of pedigree, if you don't have that piece, well, then you'll have a lot of vision and a lot of roadmap, but you'll have an inability to necessarily sort of scale to it or build to it, scope to it. And so your ceiling is a little bit lower in terms of what you can achieve. But you need both ingredients, I think, to really create magic. And the way that magic manifests is in many ways. So, in terms of the privacy policy, data should be encrypted and rest in a transit. Maybe that sounds table stakes, but sometimes it's not. There should be certain data use agreements sort of baked into the policies that you're signing up for as an individual clinician that make clear that they're not going to sell that data, that they're going to use it simply to improve the service itself for you as a clinician. So maybe the first day it doesn't recognize the new oral oncolytic name, but maybe on the third or fourth day it does. And that's the sort of magic that AI can deliver anymore. And certainly that we aspire to deliver faster than anything else out there. And at the same time, I think that, beyond that, one piece of this space that is going to, I think, prove to be table stakes and could potentially be a subject for regulation is auditability and transparency. So many of us who've played with ChatGPT or with a lot of this generative AI technology in general have probably heard the word hallucination.
Mhm.
And what it basically means is that a generative model is creating output that was not reflected in any way in the input. And sometimes, honestly, in the arts, that could be a happy accident. That could be great. When these hallucinations should be embraced sometimes. What I'm particularly interested and passionate about outside of healthcare is what generative AI could do to music. And that's really cool to see new things come out, and then you just sort of you can figure out how to leverage that stuff in your own compositions. However, I think that in healthcare it's dangerous. If you have a conversation with a patient, for example, in our space, and then you get a note, and in that note is a bunch of generated summary that is not reflected in
Mhm.
the conversation that you had, it doesn't take long for your trust to get eroded. And so that's a lot of where we've invested. And it's a long game that I think I feel strongly about. And I think I feel strongly about it because I'm a doctor, first and foremost. But it's trust. And trust is some combination of transparency, reliability, and credibility. And these auditable models, the ability in our case to like highlight a word and see where the evidence came from, highlight a sentence that was generated by the machine learning system and see where all of the evidence came from in the conversation, but even maybe listen to it. That's the sort of auditability that I think will start to differentiate companies, not just in this space, but think about what could happen to radiology in the
Yeah.
coming years as well.
And my final question, Shiv, just end off with some take-home messages they want to leave with the Kevin MD audience.
I think the biggest message is that this moment right now in 2023 is historic, and clinicians should take leadership roles and make sure that we direct this technology where we need it to be in order to create the value that we've been waiting for. Because really, ultimately, this is technology that can make healthcare feel more human again. And one last message that I'll relay is that clinicians, I think sometimes in my experience, in my kind of interactions with clinicians who are so much smarter than me in so many different ways, but so many of them I think underestimate their ability to sort of transpose the skills that they've collected in their medical training to a different sphere, whether that's business, whether that's technology. But what's so fascinating is that so many of the muscles that we created when we were in residency, rounding in the ICU, or when we did psychiatry, or when we were an internist, like listening to a patient
Mhm.
story, those skills translate so well to leadership roles in any number of industries, but certainly in technology. And so we shouldn't I think limit our ambitions here in terms of playing key roles in this new paradigm.
Shiv, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thanks so much, Kevin.